Today we're going to show you how to do or how to perform a leak test on your patients with the artificial airway. So policy states that you do a leak test in CCU and PICU, Q shift, and 4 hours prior to extubation. And what a leak test is trying to figure out is what pressure it takes for air to escape between the artificial airway and the tracheal wall itself, and that kind of increases the odds of stridor occurring post-extubation or not, depending on where the pressure is. And generally, if the pressure is higher than 20 centimeters of water pressure, for that to occur, you have a higher risk of stridor occurring when you post-extubation than if it's below 20. And in those cases, when it's greater than 20, that's when the doctor may or may not give steroids prior to pulling the tube. So what we're going to do is, the procedure is going to go like this. You have an intubated kid on a vent. He has a cuff or he doesn't have a cuff. Either way, you still, you're going to perform this test at the same time frames. If he has a cuff, you're going to deflate the cuff all the way. You're going to place him on the anesthesia bag. You're going to take a stethoscope and you're going to place it on the anterior of the airway, somewhere in the neck or just below the neck region. You should be able to hear. And what you're listening for is an inspiratory leak or a squeak, if you will, on inspiration, as you slowly increase the pressure on the anesthesia bag. And as soon as you hear the leak occur, whatever pressure is on the anesthesia bag at that moment, that is the pressure it takes to produce the leak that we're looking for. And that's where we're going to document and compass leak pressure. The last thing you would need to remember is we're not going to go any higher than 30 centimeters of water as we try to find out what pressure it takes for this leak to occur. So we'll start at, usually I'll start at the PEEP the patient is on and slowly increase that pressure all the way to 30, trying to identify at what pressure that leak occurs. And then once I get to 30, if there's no leak, I just stop, and in Compass, I'm going to chart 30 in the leak pressure with a comment that says leak greater than 30. Okay, let me know if you have any questions.